I'm Jaclyn, a pelvic physiotherapist. My patients often ask me, what is the pelvis? So today's short video is to educate you on your pelvic anatomy. Let's start with the skeletal system. The pelvis encases many bones and also many muscles, which we'll get into in a moment. But if we start with the bones, if I show you this pelvic model, if we're starting from the back of the pelvis, where the base of the spine meets the pelvis at this triangular bone known as the sacrum. If we were to follow the sacrum down, you will come to the tailbone, also known as the coccyx. The majority of the pelvis is made out of these two big innominate bones. These innominate bones can be divided into three different sections. The ilium, which makes up the bulk of this innominate bone, the pubic bone at the front of the pelvis, and the ischium, or ischial tuberosities, which make up your sit bones. If we come back to the back of the pelvis, where that sacrum, that triangular bone, meets the innominate, at the sacroiliac joint, also known or abbreviated as the SIJ joint. This can be an area of discomfort in pregnancy. If we come further around to the ilium and follow that ilium around, we will come to the pubic bone at the front of the pelvis. The two pubic bones meet in the center to make the pubic symphysis joint. This can be an area of discomfort in footballers and also in pregnancy and postnatally. If we come down, if we follow the pubic bone down, we will come to the ischial part of the innominate bone, the two sit bones or ischial tuberosities. That makes up the bony pelvis. The other joints in the pelvis are your hip joints. You will see either side here, these two circular sockets, that's where your hip joints lie. Now that we've spoken about the bones, let's now talk about the muscles. You have many muscles in your pelvis. First of all, let's talk about your hip flexors, which are a very large group of muscles that come from higher up in the spine and come through the tummy and insert into the hip joints at the front of the pelvis. Talking about the muscles at the front, you've also got your groin muscles that come lower from your thighs and insert up into the pubic bone. If we come to the back of the pelvis, you have your back muscles that insert into the back. You also have your glute muscles, there are many of them, that come off the ilium and insert into the front of the hip. And last but not least, you have the wonderful pelvic floor muscles that are at the base of the pelvis. If we look from a bird's eye view, you can see this hammock group of muscles known as your pelvic floor that come off your pubic bone from the inside at the front, come off your sit bones at the sides and insert into the sacrum or into the coccyx at the back of the pelvis. That makes up your pelvic area. As a pelvic physiotherapist, we treat any discomfort or dysfunction in this area, including the abdominals and the spine. Thank you for listening.